Hello all. So today we'll talk about one more topic, that is about solid dosage forms. So the name itself suggests about the drugs in the solid form. We'll see what drugs are there in solid form, what are the types, and what are the benefits of it, examples. So we'll study all about that in this video. Now let's learn about three main definitions. First one is dose. It is the quantity of drug which produces desired therapeutic response in a recipient. Dosage form is nothing but the product suited for administration to the patient by various routes. Formulation is like a recipe of a drug which contains name of the drug, strength and its dosage form. We'll see about the actual definitions about dosage form and formulation with this small example. So I'm taking the example Dolo 650. This everyone would have taken once in a lifetime for fever. It comes in different formulations, okay, and maximum dose we can give up to 3 gram to 4 gram per day, okay. So in this I'm taking 650 mg to reduce temperature in a patient, okay. So to reduce temperature, that is the effect I want from a drug. Definition goes by this. This is the quantity of a drug which produces therapeutic action or a response in a recipient or a patient. Okay, that is the actual meaning of dose. The dosage form is nothing but how you have given the drug or the dose. So we have given in the tablet form. So it is a solid dosage form. Okay, and formulation is nothing but what does it contain? It contains paracetamol or acetaminophen. Okay, in the strength what 650 mg in a tablet form. So to make the drugs into solid form, we add some inert substances. What are they? Let's see. Okay, so if this is the drug and I say 9% is the actual drug, next 10% is the inert substances like excipients, coloring agents, flavoring agents and the sweetening agents. We add them to give the tablet a solid form or a capsule form or a discoid shape so that it is easily palatable and patient can take it with comfort and he can be compliant to it. Excipients are the pharmacologically inert substances added to the pharmaceutical preparations to add the bulk to the smaller quantity of a drug and give it a tablet form. Okay, example like we add lactulose or calcium lactase, starch, etc. like that, so that the drug takes its tablet form. Okay, and also sometimes to mask the unpleasant taste. Then we add some coloring agents like amaranthine red, carmine, all that. Okay, and flavoring agents like we for syrups, pediatric syrups, we use some flavors like mango flavor, raspberry flavor. Okay, you would have seen flavored syrups. And then sweetening agents, we use natural sweetening agent like sucrose and also saccharin for diabetic patients and aspartame also. Aspartame is an artificial non-saccharide sweetener. It is like a sugar substitute. It is used in food and beverages also. So let's talk about solid dosage forms. In that most common are the tablets. They are nothing but they contain unit dose of one or more powdered or granular pharmaceutical components that are compressed under heavy pressure or molded into rectangular, disc-like or triangular shape. There are different types. Let's see all the types one by one. Okay, and I'll show all the examples. So first one is this uncoated tablets. Example aspirin, paracetamol. They don't have any coats. So I have the example here. So this is actually azithromycin. Can you see there's no other coat on the upper layer? Okay, this is uncoated tablet. Next one is the coated tablet. In that we have again two types, sugar coated and film coated. Sugar coated examples are chloroquine, metronidazole. Film coated are cefuroxime and diltiazem. So I'll show the film coated one. Sugar coated you would have seen, it's just a layer about upon that. And this is cefixime actually. Cefixime mass F 200 mg tablet. This is the film coat. Okay, inside is the drug. Okay, so these are the film coated tablets. Sugar coated examples I told you, metronidazole and chloroquine. So you have seen the film coated tablet, right? So these coatings are to protect the drug from air, moisture and sunlight. Okay, and coatings can be one or more layers also. Okay, then we'll see about scored tablets. Okay, so these are the scored tablets, like the common one, paracetamol. Okay, and azithromycin also. Can you see the mark in between? Can you see this mark in between? Okay, so scored tablets. So they'll have a mark in between, okay, so that the drug can be divided into two equal halves, and the drug is concentrated in every corner of the tablet, okay. So examples are paracetamol and azithromycin. Unscored tablets are other tablets like this is an unscored tablet, aceclofenac and paracetamol combination. So this is an unscored tablet. So why there's no score in this is the drug is not evenly distributed in such tablets. So that's why these are unscored and those are scored tablets. Entry coated or delayed release tablets. These are nothing but these example aspirin. You can see it's written gastro-resistant tablets. Okay, so this means these tablets contain one or multiple layers of coating so that they resist digestion by gastric acid, but they disintegrate in the alkaline medium of intestine. So these are good for gastric irritant patients. Okay, example aspirin, diclofenac. Next one is sustained release tablets. These are called extended or prolonged release tablets. Okay, example theophylline and metformin. What do you mean by sustained release is, in these drugs, the drug particles are coated with inert resins with different coatings, and so that they release at different intervals. Initially, the drug is released rapidly so that they attain therapeutic action or response, and then there will be sustained release at different intervals so that there can be maintenance therapy for prolonged period. Okay, so these are called sustained release tablets like metformin for diabetic patients, so that we have to maintain for whole 24-hour interval. So it will be mentioned as metformin SR, or for COPD patients or asthma patients, we'll give theophylline SR tablet. So there'll be SR means sustained release. So there'll be a sustained release at different intervals and different rates by disintegration of those coated drug particles. Next, we have the dispersible tablets, example amoxicillin. So it has to be put in the water and it gets disintegrated immediately, and that has to be administered. Okay, so that is dispersible tablet. One more is effervescent tablets, that is example vitamin C and N-acetylcysteine. Okay, effervescent is like dispersible tablets, but these tablets contain acidic substances, carbonates, bicarbonates. So when they come in contact with the water, they release CO2 and disintegrated in the water. Next one is chewable tablet, that is vitamin C and D3. And then next is sublingual or buccal tablets, example nitrates, GTN. These are kept under the sublingual route. Through submucosa, it directly enters into systemic circulation. Okay, it is the fastest route of administration. So it can be used in emergencies in MI patients or angina, stable angina. Next is the lozenges and troches. Example are strepsils and Vicks. So these are kept in the mouth until they are dissolved completely. And next is mouth dissolving. They are kept on the tongue and it disintegrates immediately in the oral cavity. Example ondansetron and domperidone. And also there are some drugs, Alzheimer drugs in form of mouth dissolving. They are used for this psychiatry patients because they cannot take orally. So these are the best medications for elderly, pediatric, geriatric and also psychiatric patients. So the next group is about capsules. There are 3 types depending on the gelatin layer. Okay, so it can be hard, soft and spandules. So let's see about hard capsules. It contains 2 cylindrical halves of gelatin layer. It contains powders or granule form in the capsule. Okay, then soft capsule, it has only single layer of gelatin layer. It contains liquid form, example cod liver oil. And then next is modified release capsule. They are also called as spandules. Okay, so these are modified drugs. They are modified in such a way that they release at different times, intervals, at different rates. Okay, to have a prolonged or sustained release like tablets. Example, folic acid, ferrous sulfate and omeprazole also. So these are the examples. Doxycycline. So this is an example of hard capsule. Can you see two cylindrical halves in a different color, but they contain the drug in same color with same coating. Okay, so that's how you can differentiate between spandules and hard capsule. It has two cylindrical halves, different color. Okay, remember this. And then this is the soft capsules. Okay, can you see only single layer of capsule is present, thick gelatin layer. Example, multivitamins, cod liver oil. Okay, and this is the spandule or modified release capsule. Okay, so it also contains like hard capsule, two cylindrical halves, but the content, the drug inside has different colors, red, black and white. So it has different coatings and different layer of coatings, so they release at different intervals and with different rate and time. Next group is about powders. So the drugs can be in the form of powder like amorphous or crystalline form, and there are three types: simple powder, compound and granular effervescent powders. Okay, in simple powder we have just glucose and aspirin powder. Only one compound will be present in the powder form. In compound powder, two or more ingredients are present. Example, ORS powder. And then in granular effervescent powders, the example is ENO. It has acid and alkali. When it is mixed in the water, the CO2 is released. So this is the ORS powder. Okay. So it's the example of granular effervescent powder. Next one is granules. Granules are from 0.5 mm to 2 mm size. The benefit of granules is we can add coloring agents to make them more attractive and palatable. They are kept on our tongue and swallowed with water. Example, zinc granules and calcitriol vitamin D granules. Okay. Next one is cachet. Cachet is nothing but capsule with edible covering. It has the wafer is made up of two concave halves with water and some floors, which makes it more edible. Okay. Example is vitamin A capsules and primrose oil capsules. Okay. You can see here how tablets and capsules are manufactured. Let's see other solid dosage forms. Next one is dusting powders. These are used for external application. Example, candid powder, povidone, neosporin, etc. These are suppositories. They contain suitable base so that we can insert into the body cavities like rectum, vagina and urethra. Rectal suppositories are Dulcolax for constipation, vaginal are miconazole and hydrazole combination for fungal infection, and then urethral suppositories are called Bojis. These are oral pills which are round or ovoid shaped, usually coated. Example, oral contraceptives. These are pellets, the last form. These are small, spherical in shape, size ranging from 0.5 to 1.5 mm, which are often enclosed within a capsule or compressed into small tablets. They are primarily used to provide controlled, sustained or delayed release of medication. Example, testosterone. This is all about solid dosage forms. Thank you guys.